As a physician, I intuit so much, but I don't document it. What the payers are asking us to do now is to document our thought processes.
Hey everyone, welcome to Operator Insights. My name is Julie Roberts, and today we're welcomed by Dr. Robert Wagner. He is the Executive Vice President of Physician Services here at Ensemble Health Partners. Hi, Dr. Wagner, and welcome.
Hi, Julie. Thanks for having me.
Absolutely. Dr. Wagner, tell us a little bit about Services within the revenue cycle.
Absolutely, Julie. So Services at Ensemble Health Partners encompasses three legs of what we call a chair. There's nurses, and the nurses manage whether a patient should be inpatient or obs and use criteria to do that. And we have insurance authorization associates. These associates assist the nurses and the physician advisors in scheduling peer-to-peers or moving the authorization through the process. Physician advisors are physicians specifically trained in the rules around medical necessity compliance. Within our team, the physician advisors support the nurses and insurance associates in working directly with the physicians at our client hospitals to determine the right status for the patient. That is, whether it should be inpatient or observation.
Great. So let's drill into physician advisors. So you told me kind of about what they do, but on your particular team, tell me about the team of physician advisors that you've curated.
We have a fantastic team of physician advisors. They're led by Dr. Kit Trin. These physician advisors are specifically trained in the rules around medical necessity compliance, level of care, inpatient observation, length of stay, as well as the regulatory and compliance guidelines, not only for governmental insurance, but also the specific rules around payer contracts.
Mm-hmm. And let's drill into your utilization review nurses. So tell me about that team of folks that you have and the work and how they interact with your physician advisors.
Our nurses are RNs and a few LPNs who are specifically trained in the guidelines around medical necessity compliance. These nurses are supported by insurance authorization staff who assist them in interacting specifically with the client and the facilities as well as the payers. They work directly with the payers and the nurses at the payers to determine whether the patient should be inpatient or observation, leveraging specific proprietary criteria. In addition, they work within their knowledge base to step outside those criteria and help the facility decide which patient should be inpatient, which patient should be observation.
Great. Can you tell us about the service value that your team is able to bring to our clients?
Services is a very important portion of the revenue cycle. Spanning both the front, middle, and back, Services makes decisions that affect the reimbursement associated with the patient's stay, whether that patient is inpatient or observation. By making that decision in an effective and efficient way, we're able to improve the efficiencies associated with level of care compliance, as well as decrease first pass denials.
So in terms of tracking, monitoring, overseeing the performance for our clients, what are some of the key measurements that you trend and track for that value add?
Right. It's very important that we measure specific KPIs that are associated with services. So some of the things we look at is how fast do our nurses get to a case? They get there very quickly, they make that initial status decision, and then they refer those patients for peer-to-peer. So how many patients get referred to our physicians for a peer-to-peer evaluation and speaking directly with the physician at the payer? In addition, it's very important that we decrease the initial denials as well as final denials. And those are some of the KPIs that we measure.
Great, thank you for that. Dr. Wagner, tell us a little bit about the additional value add for our clients that physician advisors bring.
The physician advisor is a very important role for our clients. Not only do we make sure that the patient's in the correct status, inpatient or observation, but we're able to work directly with your physicians, ensuring compliant documentation to support that level of care. It's important because when physicians document better, they document their thought processes. And by documenting their thought processes, differential diagnosis, et cetera, it also enhances CMI by improving DRG, CC, and MCC capture.
Great. And what does that feedback loop look like for your team? Is it one-on-one conversations with those providers, or what does that look like?
Our physician advisors are able to interact directly with the physicians at our client hospitals through multiple different media streams. For example, we can secure text message the physician some information. We can interact with them through our client newsletters. In addition, we can do grand rounds or even come to your hospital and do specific education at your internal medicine or surgical meetings.
So is it fair to say, Dr. Wagner, that your team really listens to the behavior trends that may be local to that area and try to fit what works best for those physicians?
Healthcare is local, and our physician advisors believe that. And so we take a local client-specific approach to education, depending on the specific client and how they'd like that education delivered to their physicians.
Great. I know that you've been in the field of medicine for quite some time. You are a emergency room physician by trade, and the utilization management is really important to you. Can you tell us about that link from your day-to-day provider world into revenue cycle world and how you marry that together to produce an amazing team?
So my first interaction with UR was when I was a young ER doctor. And I was on the phone with an internal medicine physician at 3 o'clock in the morning and wanting to admit a patient. And that physician told me, it doesn't meet interqual. And I literally had no idea what he was talking about. And so I endeavored to research it and find out what interqual was, and then MCG, which are sets of proprietary criteria developed by national companies, right? But then I looked more deeply into that and what really is medical necessity and how are we compliant with that? And so I endeavored to research it, understand it better, and develop it. And at the end of the day, medical necessity can be defined by the physician and the patient together, right? The physician has to work to document that medical necessity in the chart to support that. And so it's really become important to me as a practicing clinician that I help my physicians who I work with be able to document their thoughts. As a physician, I intuit so much, but I don't document it. What the payers are asking us to do now is to document our thought processes. It's really important that I work with our physicians and physician advisors to help our providers document to our payers what they're thinking in order to support the correct status for that patient.
That was good.
It's a little long.
No, it was good. It was good, right? Because we're trying to explain the why. Why do you do that work that you do, right? It's like the what and the why. Dr. Wagner, what sets Ensemble apart? The team that you and your team of physician advisors and the nurses have created here at Ensemble, what sets us apart from others in the revenue cycle outsource space?
Well, first of all, we're Ensemble, and that makes us number one, right? We think outside of the box. We do things that others aren't doing. One of the things we do that no other UR and UM services team does is we reach into the charts to get those observation patients. So it isn't pushed to us by the provider or the client. We actually go into your EMR and find those observation patients that have been in the hospital more than 24 hours and review those ourselves. And that's something that no other team does. In addition, we have what we call a three-legged chair. The UM services team is comprised of UR nurses, insurance auth associates, and physician advisors. Working in tandem, we can be so much more efficient than just physician advisors alone.
Great. If you could tell, if there was a provider in some location across the country wondering, should I reach out? Is now a good time to maybe investigate where I might have opportunities in this space? What would you tell that person?
Inside of the revenue cycle, UM services has always been what I think is a black hole. Nobody's really sure what goes on there from a finance side. We know that there's cost there. We know that there's revenue associated with medical necessity decisions. But the real understanding of how that fits within the revenue cycle itself is poorly understood. At Ensemble, we have a UM services solution that spans the entire revenue cycle, both in a full outsource model as well as a point solution. We're able to ensure that you have the most compliant revenue across the entire episode of care.
Great. Tell me, since Ensemble's growing, your team, I assume, will grow over time as well. If you have, if someone's watching this video and wondering if they should get into the space of UM or physician advisorship, what kind of person or people or clinicians are you looking for to join your team?
For UR nurses, we're looking for nurses with some UR experience. Have you ever worked inside of a hospital or for a health plan, managing status, inpatient or observation? From a physician advisor standpoint, we're looking for physician advisors with broad clinical experience, especially those who are really interested in how compliance and regulatory guidelines and contractual issues interface with our clinical care. That is, if you're interested in understanding clinical financial integration and working with a top-notch team, come join us at Ensemble.
All right, we rolled through all of my questions plus more,
Okay.
which is good. So we always like to ask one question to get to know our folks that come on the show. If you had access to a giant billboard and could put any message on that billboard, what would it be?
I'd tell my wife I loved her.
Oh,
I know, it's corny, but I would.
that's so great. I'm sure she would appreciate that.
You know, I work really, really hard. I travel a lot. I work for Ensemble. I work clinically. I'm really, really busy. And I think sometimes I don't express to those that love me how much I love them. So.
That's awesome. Thanks for sharing that with us. I appreciate that.
You're welcome.
Dr. Wagner, why don't you do our outro?
Sure, Julie. Thank you for joining us, and be on the lookout for more Operator Insights.